Hello, this is Dr. Sarah Amir, and today we are talking about psychological and behavior development in children. According to age, children go through different stages of psychological development. The first stage is the infant, which is from birth to 1 year old. Toddlers from 2 to 3 years old, preschoolers 4 to 5 years old, and school-age children from 6 to 12 years old. When relating the developmental stage to the age of the child, we have to remember that every child is unique and develop at their own pace, differently from one another. So, despite the difference we might see, most of the behaviors children display are quite normal. But we have to put in mind the developmental milestones and put it as a guide to follow up the child development. الديفلوبمنتال مايلستونز هي عتبات الطفل بيصلها في كل عمر معين. في حاجات معينة الطفل المفروض يكون بيقدر يعملها أو بيقدر يفهمها، يعني قصدنا سلوكيات الطفل ذاتها and how he deals with his surroundings، بيتعامل كيف مع البيئة المحيطة به، بتختلف completely من كل طفل والتاني، وده عادي جدا إنه يكون بيتعامل مع اللي حوالينه بطريقة مختلفة، لكن في حاجات معينة في كل عمر لازم يكون الطفل بيقدر يعملها not necessarily the same way، يعني ممكن كل طفل بيعمل الحاجة نفسها بطريقة مختلفة، لكن لازم يكون بيعملها. For example, a toddler is usually able to name certain basic surroundings like his body parts, his face, his hands, a cup, a chair, and so on. ما إلا الطفل يكون عارفهم كلهم أو يكون بيقدر يقولهم، بس يكون يعني he can point them out، يعني تقول له عينك وين، أذانك وين الكرسي، وين الترابيزة. كل طفل مختلف، ممكن a child will point it out يقوم يأشر عليها يعني، وفي طفل حيعاين لها بس، في طفل حيجري عليها يهبشها، في طفل حيوريك بس إنه فاهم إنه هي دي شنو، لكن في طفل ممكن يقولها عادي يقول لك أيوة دي، لكن في طفل بس ممكن يأشر عليها ساي من دون كلام، في طفل ممكن بس يغمض لك عيونه لما تقول العيون. فكيف يعملوا الحاجة دي it's different من كل واحد والتاني، لكن في الآخر لازم يكون بيقدر يعملها. فالديفرنس ده ما مشكلة، المايلستونز هي المشكلة، يعني لازم في عمر معين يكون عارف عينه وينه، يعني ممكن يأشر لها بطريقة مختلفة، يكون عنده لها اسم براو، عينك وين يقول نن، يقول بتاع أي حاجة، لكن الديفرنس ما مشكلة، لكن لازم يكون وصل المايلستون. فالمايلستون دي هنستعملها as a guide، إنه هل وصل للمرحلة بتاعت إنه يتعرف على عينه، أيوة. مرحلة إنه يقولها دي حاجة مختلفة، إنه يتعرف عليها بيئة طريقة دي حاجة مختلفة. عشان كده البيزك بوينت هي إنه every child is different وعنده a different pace to grow، لكن milestones must be used as a guide and as a guide only. So now we are going to discuss the emotional milestones. At the age of 2, the child is very attached to his parents and fearful of strangers. They are active, running and jumping around, likes to see and touch, but they are very self-centered. Self-centered يعني ما ممكن تقول له والله عشان ما أزعل ولا عشان الولد ده برضو يلعب please share with him. لا، it has to be related and affecting him to respond. يعني تقول له عشان ما أزعل منك، عشان أنت not to get punished، ما تتعاقب، عشان هو صاحبك وعشان هو he shares with you his stuff، أنت برضو you should share your stuff. Generally, 2 years old are called terrible too. We said the age of 2 years old is called terrible too, and it's called so because no is their favorite word. It's the answer to everything, and they get tantrums to every no they get. They easily get frustrated. Tantrums are the hysterical episodes of crying. At the age of 2, they love to ask why, so we have lots of explaining to do. But the good thing is that they have very short attention span, so they easily get distracted. They can pay attention no more than 5 minutes maximum. So we have to have short, clear sentences for instructions when dealing with those children. At 3 years of age, the very egocentric, self-centered child starts to get a little less egocentric. The world still revolves around him, but he's more independent and starts looking up for adults. He admires them, so he mimics their behavior and he's more eager to please. Children at this age have great imagination, so they enjoy stories and rituals and start creating fantasy worlds and imaginary friends. We can make use of this point in dealing with children at this age by adding some excitement to the dental procedures, having some rituals, dear chair, go up please, dear chair, it's time we go home, and so on. Giving the dental instruments other names can be helped with some exciting imaginary stories or characters. This will help ease the patient and promote the fear desensitization process. But we have to remember that the attention span, though longer than that at age of 2, but it ranges only from 4 to 8 minutes maximum. By the age of 4 years old, the child becomes independent, develops sense of awareness, personality, and their identities starts to develop. And since he's developing his own personality, the struggle of power starts. They also start socializing and having conversations. They start grasping the concept of reason, so as expected, they continue to ask why about every single thing. By the time the child reaches the age of 5, the child is confident, independent, and controlled. They are fluent and take pride of their possessions. At this age, the struggle starts to slow down. They accept authority. They can also tolerate a little discomfort, just a little. 6 to 12 years old. At this age, the child will be asking serious questions at the age of interrogations. An important point to pay attention to is that they start to choose to interact, they prefer to interact with children of the same gender. This is important because if we want to do some modeling and show the patient another child who's having a dental procedure, so we can try to make the patient less anxious, we have to remember to have this example with a child of the same gender and the same age group. We also have to know that children at this age argue and challenge parental values. They extend their experiences beyond the family. They are very moody, and a dentist should be very aware of this. Now we are going to start talking about communication and the best ways to communicate with children at each age group. Short, clear, and simple commands with simple choices are necessary when dealing with children at the age of 2 due to their very short attention span. And you have to be consistent. We also have to praise the egocentric 2 years old child. Children between 3 and 6 years old will appreciate the encouragement and definitely the praise for good behavior. You still have to keep the instructions clear and simple and answer all their endless questions. You also have to pay attention to their feelings and talk to them about fear and how they feel. Children between 6 and 12 years old, as we said, can be very argumentative and they may have very challenging behaviors. So clear limits must be set, consequences implemented before all. We also have to be clear about our expectations from those children. The most important thing that we have to know that support and encouragement are the key words to establish a good patient-dentist relationship with children at this age. This is all for today. Thank you very much.